Hi everyone, Dr. Cary Yurkiw here, and welcome to today's webinar on how to get rid of neck pain quickly. It's a topic that comes up in the clinic, and it's a very popular question we get. So wanted to go over that today and what you can do to help yourself. My name is Dr. Cary Yurkiw. I'm a chiropractor in Kelowna, British Columbia, and that's in Canada. I've had over 25 years of practice experience in chiropractic, so I've helped over 10,000 patients in the clinic, and I've done over 100,000 adjustments. I would say about 30% of those adjustments would be neck adjustments, so over 30,000 neck adjustments. And today I'm going to talk about what we can do to help you and what you can do to help yourself. So the question is, how do I fix neck pain quickly? I think the first thing you want to do is you want to find the cause. And so talking to a health professional like a chiropractor, a medical doctor, physical therapist, somebody you trust, and maybe you're referred to from a friend or another health professional, is the first step. So you want to find out more about it and what's causing it. And then once you consult with that health professional, once the chiropractor tells you what the problem is, then the next step is getting the right treatment for it. So for treatment, you want to relieve the neck pain. So we want to open up the spaces between the bones so the nerve flow can get through. We want to take the pressure off the tissues in the area. We want to improve range of motion or the function of the spine and improve the alignment and the posture. So that's very important. Now, you can't do that on your own. Even chiropractors don't adjust their own spines, and we go to see other chiropractors. So I'd highly recommend trusting a professional to do this for you. And that's the first step of getting some relief and starting what I would call a positive cycle of correcting a neck problem. And then the next thing would be how to stop neck pain from coming back. Well, you want to change your life. You don't want to keep doing the same things because it'll cause the same problem to come back. So, for example, a lot of people work at a workstation now and you're sitting at a desk. And we know from research that posture, the way the monitor is set up, the height of the table, your chair, all of those are very important. And then a lot of research is showing that you need to get up and walk around and stand up every hour at least. I use the Pomodoro method, which is like a 25-minute session where I'm sitting, and then there's a 5-minute break or 10-minute break where I'll stand up, walk around, and come back to my desk. So if you want to look up the Pomodoro method, it's a great way, and there's an extension for Chrome, so you can use it on your browser. And then, of course, good posture. Just making sure that your shoulders, your back's not rounded too much. Your eye level is good. You're not looking down or up too much. So posture is important, and definitely a health professional can work with you on that. Or you can just look it up online and see what you can do to help yourself to improve your posture. Also, you want to be conscious of stress levels. Stress levels can cause tension in the body and cause neck pain to come back. You want to get enough rest because sleep helps with the body healing. You want to get enough water. Water is important for hydration in the body, especially things like the discs, where when you're sleeping, the discs actually expand in volume quite a bit. Some research says up to 1/3 of the volume of the disc is just by resting or sleeping, non-weight bearing. So when you stand up in the morning, you're a little taller than you were when you went to bed. Electrolytes are important. These are the basic salts for the cells and throughout the body. Things like sodium and potassium and chloride, magnesium, different types of electrolytes that help the cells function and the tissues function, especially if they're going to be repaired by getting a neck problem corrected. And then activity, doing different types of activities, stretches and exercises. That's going to help with maintaining the movement in the area, the alignment. It's also going to help by circulating nutrients in the joint spaces in the discs and the cartilaginous areas, because there's not a lot of great blood flow after your teenage years in that area. So you want to make sure you have good movement so it heals those tissues. As far as nutrition, You really want to give the proper nutrients to the bones. Things like calcium are important. Exercise. The muscles, and that would be like protein and again, electrolytes. For the joints, you might want to look into something like collagen, which is really good for healing of connective tissue. And then the nerves. And the nerves rely on water, hydration, electricity, so electrolytes, and things like omega-3 fatty acids or fish oils are really good for the nervous system. I like making a smoothie personally because smoothies really help with getting all the right ingredients in your body first thing in the morning. For movement, movement's important for circulation in the joints. You can just go for a walk for 30 minutes, or some research is showing some interval training is really good. So short bursts of intense activity and then walking. So like a little sprint and then walking and then a sprint again. Strengthening, so some weight bearing activities, core strength using weights. Nerve muscle connection, those are like proprioception, balance. And then, of course, nutrition for getting the tissues to get stronger. Protein, plant-based proteins. Also, what you can do to stop it from coming back is having better posture. And that includes like when you're standing or sitting in your car, sitting at your desk, doing certain stretches and exercises to help yourself when you are sitting for long periods, or first thing in the morning before bed. Those are good times to exercise as well and do stretches. And I would talk to your health professional about that. I like to give out yoga type of stretches in the clinic because I find yoga stretches to be very gentle and a fluid type of movement, which works within the range of motion of the patient. So as your body's healing, your neck's healing, working within that limit, but expanding those limits with your health professional and doing exercises, I think is really important. Here's some simple steps that you can do to strengthen your neck. So as your neck heals and the pain's going away, the range of motion's coming back, the alignment is being restored. Some of the things I like to give my patients is things like core strength, and this is going to help to support the spine in a better place and prevent it from being re-injured or going back to the way it was. So the plank is really good because by holding your body parallel to the floor and holding this position for 5 to 10 seconds, it works the muscles around the spine. You can build up in time and you can build up in repetitions, but just starting with 5 to 10 seconds, doing 2 to 3 repetitions is a good way to start. And then you can increase that duration as your body gets stronger. For extensions, just being parallel to the floor, raising your upper body off the ground, holding for 3 to 5 seconds. Just be careful of the angle of your neck. Try to keep the spine in kind of a gradual plane here. So you're going to be arching your back, but each segment should be arching a little bit, not pivoting so much where the shoulders meet the neck. And I see a lot of people doing that. So just hold for 3 to 5 seconds with a gradual arch, lifting your upper body and your neck off the ground. For shoulders, shoulders are important because this shoulder area supports the good alignment of the neck and the upper part of the back. So building up strength and support, you could do that by using weights like a deltoid activity like this, or you can do shoulder presses. Those are good too. So I would talk to a personal trainer or your health professional about this, but building up strength in the shoulders is very important. The trapezius is important too because the muscles going from the neck to the upper part, like the clavicle area and the scapula. So these scalene muscles and the trapezius are muscles going right from the neck into the upper shoulder area. Shoulder shrugs are good for this, but just be careful you're not doing them too high or with too much weight. It can actually pinch a nerve in the neck. So if you already have a nerve condition, check with your health professional before you start these. These muscles also tie into the neck, and they'll build strength and support around the spine in the neck area. And then you can buy devices like this. I found this one on Amazon where it attaches to your head and there's a pulley system, and you can really start to strengthen the muscles in the neck. Again, be really careful with this. Talk to a health professional or a trainer before you start this. There's different devices that attach to pulleys and provide resistance, so you can really work on strengthening the neck muscles that would be like the sternocleidomastoid, the SCM right here, going from the skull area down into the collarbone area. And then other muscles like the scalenes in the front of the neck, the posterior um, paraspinal muscles here in the neck area. So there's different groups of muscles, and you want to work those groups individually. And talking to a professional about that would be important. Um, I want to encourage you to follow me on social media. I'm on Instagram, Facebook, and Twitter. We're always posting different things of value for the people who follow us. So, follow us there. You're going to get the posts, and they're going to be about tips like this, upcoming events, what we're doing in the clinic, um, books that we're publishing. So there's a bunch of different topics that we share on social media. We also have a podcast on Apple and Android called Super Healthy. This webinar will be posted to that podcast, so you're going to get the feed if you sign up for that on your podcast provider. On Eventbrite, type in Yurkiw Chiropractic. You're going to see our upcoming events. A lot of them are free, but there are some paid webinars and paid workshops. So if you like this topic and you want to know more, we are doing more and more paid workshops and paid webinars where we get more in depth and answer questions, that type of thing. They're not very expensive, usually around $25 to $30 US for a paid webinar or workshop. For new patients, if you're in the Kelowna area, you can click on the link below, and there'll be a link to book an appointment. Usually we can see new patients in 24 to 48 hours. So if you click on that, you can choose a time and we can see you in the clinic and then help you with your neck condition or any other spinal or joint condition that you're currently experiencing. And I want to thank you very much for joining me today. I hope you learned something about the neck and how you can help yourself, what you should do if you have neck pain. And please join us for the upcoming webinars on Eventbrite. Also, I look forward to communicating with you on social media, our YouTube channel, and if you're in the Kelowna area, please book an appointment, and we hope to see you soon.